My presentation will be about quality labeling and certification of service provider platforms. And we've been hearing throughout the morning sessions a couple of times the terms of quality labeling and certification. And in fact, what we often hear is that quality labeling, certification, accreditation, evaluation are used interchangeably, but in fact, those terms are not synonyms. So there's a difference between them, and I would like to start with pointing out that difference. Now, based on a couple of European research projects in which we have been discussing quality labeling and certification, certification is the process of issuing a written assurance, which we call in fact the certificate, that an independent accredited organization has audited and verified that a product or service meets certain specified criteria or quality criteria. We've been doing that in the EHR QTN project, which was in fact a thematic network for promoting EHRs and the use of high quality EHRs in many member states around Europe. And we've been also discussing that into the HITCH project, which was about healthcare interoperability testing and conformance harmonization. Now, there's a difference between quality labeling and certification, and the difference in fact is shown in this figure, which is a limited figure, but it shows the actors involved in the quality labeling and certification process. So in fact, what you see on the bottom left is what we call a conformity assessment body, and that is in fact the testing body which undertakes the testing. So there is, first of all, a difference between certification and testing, and it is the conformity assessment body that tests the product or service and then reports to the certification body. And the certification body either issues a label or certificate, whether it is accredited or not. That is in fact the picture. So there is a difference between testing, certification, between quality labeling, and between accreditation. And you see, we've been doing that, or we have been doing work on that into the HITCH project, the Antelope project, and the EHR QTN project. Now, quality labeling and certification is one of the key aspects which we take forward, not only from the EHR for SIA project, but also from other European research projects. And it's one of the key sustainable activities which we will do within the new institute. Now, for those of you who have been looking at either the brochure in the leaflet package or on the website of IHD, there are a number of objective value propositions for each of the stakeholders mentioned. And I've picked out two of them regarding quality labeling and certification, either for pharma, which are important for pharma, or for healthcare ICT vendors. And the idea really is to set up a kind of formal collaboration between either the new institute, between EuroRec when it comes to the quality labeling and certification aspect, and also together with my department at the Ghent University and with the spin-off company Ramit. We've been all very active in the quality labeling and certification scene, and I will talk to you later about that in a couple of slides. Now, what are the aims of such a quality labeling and certification program within the IHD or the new institute? It is about providing confirmation and recognition of the competence of an organization, to give an indication that the service provider is operating in accordance to the specified IHD criteria on which we are working. And very important, we've been hearing the word trust and trustworthiness a couple of times today, and I think you can agree in also looking at the comic picture that ensuring trust in the service provider is a very important aspect. Now, we've been defining 4 stages or 4 phases in the quality labeling and certification framework. And first of all, you need to set up the governance framework for doing that and defining all the rules and the roles, responsibilities of the several actors involved. Then there will be an application and a kind of pre-assessment phase. The pre-assessment is where, in fact, the applicant provides some self-assessment. And based on the self-assessment, we will proceed with the actual assessment phase, which will involve an on-site testing, looking at the conformance of the several criteria. And then the 4th and final phase is the phase of evaluation and then the issuing of the certificate or the label. Talking about the specific criteria, we've been defining 4 major categories. The first one is, well, in fact, the general category, consisting of a number of basic requirements a service provider have to meet. Then there is the service provisioning part, dealing with a number of aspects, such as extracting and reporting of data, security aspects. And then there are a couple of IT-related aspects, the IT platform and the IT infrastructure. And you see a number of headings of the several criteria on this slide. Now, we are not doing this work alone, and I think Deepak has already mentioned that there is a kind of collaboration with several other organizations, and you see here a number of actors also involved with whom we are working together on this. There is the eClinical Forum, there is EQUIN, there is the German Institute providing some requirements, and there is, of course, EUROREC. EUROREC, which I will talk to you later on, is in fact, or has the expertise in quality labeling and certification of electronic health records. Now, the various sources, you can see them on this slide. Regarding the eClinical Forum, we are talking about the ESRA requirements. Maybe some of you are aware of those quality criteria, which some units have to meet for storing source data during clinical trials. There are, of course, the EQUIN criteria when it comes to accreditation or certification of EQUIN data centers, so members of the EQUIN network. There is a German institution called the Federal Office for Information Security, which has also outlined some security requirements for cloud computing providers. And then there is the European Institute for Health Records, for which I'm also representing today for giving this lecture. You see that I haven't mentioned what EUROREC is about, and that is the purpose of the next slide. So for those of you who are not familiar with EUROREC, EUROREC is a not-for-profit organization. In fact, it's a kind of umbrella organization federating a number of national PROREC centers. And the main mission is really to promote the high use or the use of high-quality electronic health records in Europe and also beyond. And throughout the years, we've built quite some expertise in quality labeling and certification of electronic health records. Well, we kind of started with electronic health records, but we are moving also, I would say, to the mHealth scene. We are moving to interoperability assets and also to quality labeling and certification of research platforms for health data reuse. What is our main asset? Well, the main asset is the big repository we have of quality criteria, and I think I can say that maybe we have the largest set of quality criteria in Europe when it comes to EHRs. The repository currently has more than 1,700 quality criteria which are indexed, so which can easily be browsed using our tools and can be used in the various quality labeling and certification settings. They have been validated. I was referring earlier to the EHR QTN project, and the criteria have been validated at that time in the 25 member states, so we are talking a couple of years ago, and up to now we have been translating them partially in 20 European languages. In addition to the repository, we've been creating a number of what we call quality seals, and the purpose of the quality seals is to provide a kind of validation service against cross-border subset of quality criteria. Basically, we began with two seals, what we call a seal level 1 and seal level 2. Seal level 1 consisted of a basic minimal set of criteria. It consists of 20 functional quality criteria. We've been extending that set based on the outcome of the European Research Project, and we've been adding up to 50 criteria, really addressing various essential functions of EHRs. In addition to that, we've been working with eClinical Forum to define what we call an EHR CR profile at the time. So when it comes to dealing with reusing clinical data for research. Then we've been creating a number of seals according to the projects. We've been very active in many European research projects, the EHR for CR project for sure. We've been also defining quality criteria for the Eureka project, where we set up the quality labeling and certification framework. We've been doing work on quality labeling of interoperability assets. That was within the Expand project. We've been also taking that work up into the EUROREC repository. And then, of course, there is the service provider platforms. That is the latest way we are moving towards in providing or defining quality criteria and setting up the quality assurance framework for that. We have developed and maintained, in addition with Ramit, the spin-off company, a number of quality labeling and certification tools. You see here the tool suite consisting of 4 components. There is it begins with the composer component, where we in fact select the quality criteria out of the repository. That is the main functionality of that tool. We have a certifier tool where we create, once we've selected the criteria, a kind of certification set or quality labeling set of criteria. And then, in fact, for each testing purpose, we create a test scenario. And a test scenario is really a real-life scenario for which we define several testing scripts. And the test scripts then address one or many of the quality criteria. And then we have some web application assisting us in really conducting the conformance tests and also assist us in the evaluation process of that. I was talking to you about the scenario-based testing, and in fact, based on a number of criteria, we define test scripts. So a test script can either address one criteria, it can address many criteria. Some criteria, they come back in a number of test scripts, and then the collection of test scripts is really the test-based scenario which we used in a kind of quality labeling or certification session. Here you see one example of one test script addressing 4 criteria. It's about generating a specific report for a patient, and in order to do that you have to meet 4 criteria, which all of 4 then are tested in such kind of test session. The next couple of slides really are some screenshots of the functionality of the tools, and maybe I will not bother you with going to the screenshots. I would like to propose you, since we are here, we have a booth with a nice poster, a roll-up. We can give you some demos, so please, if you have questions on the quality labeling certification framework, either all the tools or the repository, please come visit me or my colleagues during lunch or during break. So the first screenshot is about the composer and certifier tool. Basically, it is selecting out of our repository the criteria we want to work with. Then we write scripts, or we reuse scripts, which we have developed previously. A script is assigned to one or more criteria, which are then used in a kind of scenario building tool in which we want to further complete the test scenario. And then we have a web application assisting us in conducting the real test. Basically, this is what the Eurorec quality labeling and certification tool are about. We have a website. Please visit that website for more information. But if you have any questions, please come and visit us during lunch or during the afternoon break. Thank you very much for your attention.